On Monday, the World Health Organization and its COVAX partners announced that they were working to establish a COVID-19 vaccine production hub in Africa. The step is designed to boost vaccine supplies on the continent for current and future outbreaks. According to the WHO, it was already in talks with the South African consortium comprising Afrigen Biologics and Vaccines, a network of universities, and Africa's Center for Disease Control and Prevention to establish the first COVID mRNA vaccine technology transfer hub in Africa. The move follows WHO's global call for expression of interest, EOI, on 16 April 2021 to establish COVID mRNA vaccine technology transfer hubs to scale up production and access to COVID vaccines. Over the coming weeks, WHO will continue the rolling evaluation of other proposals from low and middle-income countries in Africa and other continents. To discuss Nigeria's preparedness to take on this unique opportunity aimed at improving access to health products, we're now being joined by Dr. EBERE Okерeke, a consultant on global public health and communicable disease control and lead for Public Health England. Welcome to the program, Dr. Okерeke. Good morning.
Good morning. It's a pleasure to be here.
Yeah, and it's a pleasure to have you join us on the morning show. Very quickly, Dr. Okерeke, how important is this, plan to make some countries in Africa the hub for vaccine production in the continent? How does that contribute to the search in terms of global solidarity and vaccine equity across the world?
I'm going to step back a minute first to talk about vaccines in general and why they're so important. So the first thing is that besides clean water, vaccines are the most effective, both in terms of impact on health and cost, public health intervention we have ever created globally. So there is no argument about how important vaccines are. We've eradicated some diseases, smallpox predominantly, and we're almost there with polio as a consequence of access to effective vaccines. So looking at why it's important for Africa particularly, we need to recognize that a lot of the emerging infections and old diseases that are still causing problems in Africa are becoming less and less of a problem in the rest of the world. So it's a health security imperative for us to develop vaccine manufacturing. Currently, only 1% of our vaccine needs on the continent are actually locally produced. We depend on the rest of the world for 99%. That makes us vulnerable. And if we look at the current situation with COVID, Africa is at the bottom of the queue. Understandably, other countries are prioritizing their own countries, and we are not getting, at the moment, I think UK, for example, where I'm based, is approaching 70% of its population getting vaccinated against COVID. Across the whole African continent, the cover at this moment is not even quite at 2%. So we do need to start to consider vaccine manufacture on the continent so that we can be, for health security, and also to expand and develop the industry. It is a potential employer of expertise on the continent. A lot of our experts are working globally, and if we have a robust industry, we might be able to track them back, develop them, and there's all the ancillary services to support a vaccine manufacturing industry that would be an advantage to us economically.
What is the significance of Nigeria potentially being one of those technology transfer hubs for the mRNA vaccines, such as Pfizer and Moderna's vaccine, which are not currently available in Nigeria? What we have is AstraZeneca, which is a vector vaccine. Is that significant in any way?
Right. I'm going to step back a little bit and look at the entire vaccine value chain. In producing vaccines, you can start from producing the actual active drug substance all the way through to a fill and finish. And there are different technologies for producing the different vaccines, mRNA being one of them. And AstraZeneca that you referred to is an adenovirus vaccine technology. Now, to the advantage of Nigeria specifically, and I will just go on a little bit about the tech a bit more. Technological transfer involves partnering with the organizations or companies globally who have produced those vaccines so that they actually train you to be able to deliver on one aspect of the production chain locally. The advantage being it's closer to where you're going to use it. To come to the case for Nigeria specifically, Nigeria is a big country. We have a huge population and a growing population. The estimate is that the population on the African continent generally will continue to grow and will move from, I think it's around 15–16% of the global population today, but by 2050 it's expected that it's going to be about 25% of the global population. And a significant amount of that population will be young, people for whom vaccinations are, most vaccination programs are designed. At the moment, across the continent, we don't have full penetration for vaccination programs, in that there's a lot more people that need vaccines than we're currently delivering. So focusing on vaccinations is important across Africa, but particularly for Nigeria because of its population size and its impact. Nigeria has a built-in domestic market, but in producing vaccines for Nigeria, we're not just thinking about the domestic market, we're thinking about the global market, and if we're ambitious, we're thinking beyond. If you think of the fact that India and China are significant producers for vaccines for the entire world, not just their own populations, but the fact that Nigeria has an inbuilt starting population that's big enough to justify the cost, because let's not make any assumptions. Vaccine manufacture is not cheap. And in order to actually invest in that, you need to ensure that there is an accessible market that justifies it, and you need to ensure that it can be done at a cost that is affordable. So that's the case for Nigeria. A particular case for Nigeria is that currently we get most of our vaccines through Gavi, and Gavi negotiates with the manufacturers globally to get a subsidized rate. Nigeria is about to reach the stage where it's no longer qualifying for that Gavi subsidized rate. So we need to be looking at how we ensure that we can continue to get the vaccines we need, expand to some of the newer vaccines that we currently don't yet have in our program, and local manufacture will be an advantage to that. Now, specifically about mRNA, mRNA vaccine technology is a game changer. The speed with which it was able to develop a number of the current COVID vaccines is not just about COVID, but the potential to use mRNA technology for other diseases, and most interestingly and excitingly for us in Nigeria and Africa, is malaria. Malaria is still a major killer on this continent and in Nigeria. So access to a vaccine that is effective is critical for Nigeria for us to improve child health. So there are lots of reasons why Nigeria should be part of these conversations. Right. Then I wanted to just talk about the hubs, and to expand on your intro at the beginning, you talked about the WHO initiative. I should stress that it's not just WHO that are having this conversation. For a few years now, there's an African vaccine manufacturer initiative that has been exploring and looking at the enablers and the barriers to vaccine manufacture on the continent. And earlier this year, in April, the Africa Centers for Disease Control convened a summit to discuss and launch a partnership for African vaccine manufacture. And that is coordinating across the globe, supporting countries with potential, with interest, to actually identify partners, funding, the technology, the expertise to move from ambitions to reality. They've set a goal for the African continent to move from the current 1% of local manufacture to 60% of local manufacture by 2040. It's ambitious, but it has the backing of the African Union, and therefore with that political commitment, with the creation of the Africa Free Trade area, there is a potential to actually achieve that.
Right. Great and excited to see you again, Dr. EBERE Okерeke. Yeah. While we're talking, we had a conversation about funding. You talked about MasterCard, ready to put some money down so that Nigeria can actually produce its vaccines. Elaborate on that conversation.
Right. 2 weeks ago now, MasterCard made an announcement of a commitment to support vaccine manufacture and access to vaccines for the African continent. This is MasterCard Foundation of Canada, I should be specific. And this was a huge announcement of $1.3 billion US to support vaccine manufacture across the globe, to support access the delivery of COVID vaccines specifically, particularly looking at things around health systems at local level, that last mile. As you may have heard a few weeks ago, there was a report of an African country having to destroy expired COVID vaccines because they couldn't get it to the people who needed it. There were a number of factors contributing to that. And so it's not just about producing the vaccine, but it's ensuring that the systems and the logistics and the mechanisms are on the ground to actually get the vaccines to where they're needed. That is not always as straightforward as we'd like it to be, especially on our continent where transport and electricity supply for cold storage can be challenging. And the MasterCard Foundation has put their money effectively under the coordination of the Africa Center for Disease Control because of its continental reach, its political mandate from the AU, and its ambition to work through national public health institutions and ministries of health to provide expertise, knowledge, advice, support, and work in partnership to achieve public health improvements globally, but currently, based on what we're talking about, COVID in particular, and vaccines in the more broader sense.
Well, very quickly, we'll soon take a break, but before we go on that break, I'd like to ask you, what is the connection between this proposal to establish production hubs in Africa and what is already happening in some African countries? Senegal is already working on a vaccine production. Egypt is partnering with Sinovac, and in fact, they're planning to produce about 60 million vaccines. You also have South Africa, which has been producing in Port Elizabeth, what they call the Fill and Finish program, in partnership with Johnson & Johnson. So how is this technology transfer, know-how, hub, and all of that, how is it different? And is it an advancement on the request for intellectual property waiver? Is that part of it? But let's take a break, and then we'll come back, and then we'll talk more about it. Thank you very much. We'll be right back.
Okay.
Welcome back to the Morning Show here on the Arise News channel. Our guest is still Dr. EBERE Okereke, a consultant on global public health and communicable disease control and lead for Public Health England. Dr. Okereke, thank you for staying with us. So before we went on break, I'd asked you that question. Over to you.
Yeah, right. So just to clarify, I'm not the lead for Public Health England. I lead a global health security project for Public Health England.
Oh, okay.
Currently, I'm actually working directly through with Africa CDC and the West Africa Health Organization through the Tony Blair Governance Initiative, because we're focusing on supporting those two regional public health bodies to take advantage of the opportunity of the focus on public health that the COVID pandemic has brought. So to your question, you asked how the WHO hub is linked to all the other initiatives going on across the continent for vaccine manufacture. So they're all connected. We should stress, like I mentioned earlier, that there has been an Africa Vaccine Manufacture Initiative going on for a few years, looking at how do we actually improve and expand on the manufacturing industry. We have already had some vaccine manufacturing happening on the continent. You mentioned Senegal. Senegal has been producing an approved yellow fever vaccine on the continent for many, many years now. So there are also programs like you described in Egypt looking at producing COVID vaccinations specifically. We have ambitions to build up vaccine capacity, not just for COVID, but to start to address our immediate vaccine needs for the childhood immunization programs, the new vaccines that we are not yet using as extensively as we should do, and also to look at the opportunity for vaccine development for diseases that are unique or priorities for us that may not be such priorities for the rest of the world. So all these things are connected, and the connection is really the Partnership for Africa Vaccine Manufacture, led by Africa CDC on behalf of the Africa Union. The aim is to ask countries who are thinking about or who should be thinking about vaccine manufacture to support them in understanding the value chain. You mentioned tech transfer, you've mentioned IP, and you've mentioned fill and finish. All of those things are part of the value chain in vaccine manufacture. So, for example, intellectual property is about the people who developed the vaccine, who basically therefore own the formula. And there has been a move to say that in a global pandemic, you should really be enabling free access to that intellectual property so that other people can manufacture to increase the volume of vaccine available in a hurry. If we're to contain the COVID pandemic, we really do need to get as many people vaccinated as quickly as possible. Like the director of WHO keeps saying, Dr. Tedros, he said, COVID-19 anywhere puts all of us at risk. So that is a complex issue, and control of the IP is just one aspect of vaccine manufacture. You need to ensure that there's the technology to produce vaccines wherever they are. So that's where tech transfer comes in. And then there's the end product, which is around building up volume quickly, which is having maybe the product is produced somewhere else and then shipped in bulk to a country that then does fill and finish, which is about putting the vaccine in the vials and the packaging for the market. So there's a whole spectrum on the value chain for vaccine manufacture, and we're encouraging countries to look at the entire spectrum, identify where they have capacity, where they have skills, where they may already have experience, and it might be starting with fill and finish, which is closer to the end of the chain, and at some point moving into actual drug substance manufacture, intellectual tech transfer to allow you to actually use a pre-existing technology that has been designed along that pathway. So they're all coordinated, they're all linked into that greater whole, which is about a manufacturing industry on the continent that increases our security in terms of access to vaccine in the future. And it's not just about vaccines. This is an issue around the entire pharmaceutical needs of the continent. We are significantly dependent on drug products that are imported from across the globe to meet our needs, even for essential drugs for our everyday use. So we do need to start to think broadly about the need for a pharmaceutical industry that is sustainable. And the sustainability leads to the issue of hubs. So we don't want African countries competing with each other. Yes, we have a big population of 1.2 billion, but there's also a lot that needs to be done. So we're looking at how we align and collaborate between countries and across the continent to ensure that we meet the needs in the broader sense. So some people will go for fill and finish, some will go for tech transfers, and some will go for mRNA technology, some will go for adenovirus technology, and everything else that is in the spectrum of vaccine manufacture. So it's linked. It's not, they're not sort of fragmented pieces of a whole.
Right. And what about collaboration between interested manufacturers in Nigeria, and where you think Nigeria is best placed to serve in this new scheme? And also a different question. I want your take on proposals for a pandemic treaty, especially based on the fact that COVID-19 has just been such a cataclysmic disaster. What do you think, and what should that treaty contain? Especially, I have to say again, the fact that the general assumption is that a pandemic will always start in Africa. That's how we're viewed, and this is not what happened this time. So what do you say to all of those proposals?
Right, so I'll answer the first question. So what's the role of manufacturers in Nigeria? They have to step up. Nigeria needs to be part of the conversation for vaccine manufacture for the reasons I'd already outlined. Nigeria already has some of the capacity that's needed to start. You have pharmaceutical companies here, we have our research and development capacity here, we have interests, and there is a big market, like I say, a population estimate of 200 million means that you actually have a built-in starter market. So the way to move forward is actually to start the conversation amongst the capacity we have in the country with partners globally who have an interest. There is interest in working with Nigeria globally, And we need a political commitment to lead that agenda. It needs to be, because we're going to need to make sure that there's the right regulatory frameworks. There's issues around importing essential components for the manufacturing industry, which requires political leadership to address. So Nigeria has a role to play, and it is important that Nigeria steps up and joins the conversation now, while there is so much opportunity to build this industry across the continent. Now, you asked about a pandemic treaty. That's a broad area, and it depends on what we're thinking about. To answer your question about the belief has always been that the pandemics will start from Africa. I don't think that is strictly true. For example, we were quite confident that if there was going to be a respiratory infection causing a global pandemic, that China was actually a likely place for it to start. And the reasons that you consider why an area is a likely hotbed for emerging infections is the combination of population size, population growth, expansion into new land, which interrupts the ecosystem. And those factors exist not just across Africa, but in other parts of the world as well. But that said, in Africa, we have seen regularly outbreaks of new or re-emerging infections that have caused moderate to significant outbreaks, mostly not becoming a global pandemic, and therefore the interest has been slightly moderate from the global north. Nigeria, for example, we've seen the largest Lassa fever outbreaks. We've seen most recently largest monkeypox outbreaks. Let's not forget the old diseases. Tuberculosis is still a big problem here. We've touched on the fact that malaria is endemic here. So to answer your question about what should be in a pandemic treaty, we already have regulations. The international health regulations were signed up by all 195 WHO member states, which is around the principles for what we need to have in place and what systems and measures and what approaches we need to take in response to the risk or to public health events of potential international concern. Nigeria is signed up to international health regulations, and led by the Nigeria Center for Disease Control, in 2017, it went through the joint external evaluation with the WHO to look at Nigerian capacity to comply with those regulations. There was room for development, and I'm really pleased that, having worked with Nigeria CDC, led by Dr. Chikwe, they have made a lot of progress in addressing some of those gaps. They've improved their emergency response and coordination systems. Their surveillance system continues to improve. There's still room for development. Globally, the discussion at the moment is how do we make sure that when we're actually in a crisis, governments and systems do what they're supposed to do. I'm not going to claim to have the complete solution to or answer to that, because it's an issue of sovereignty and what politicians are willing to commit to do and then stick with. There's big discussions at the moment in WHO. There has been a report just produced recommending changes to international health regulations to ensure that we can actually respond slightly better than we did this time. But the biggest challenge is nationalism. And that is about, protectionism and saying my people first. It's understandable, but in reality, so long as there's a COVID or whatever the next pandemic is, being no doubt, there will be another pandemic. That is the nature of the human existence. Whatever it is, so long as there is cases somewhere, there will be cases elsewhere.
Well, thank you very much, Dr. Okereke. We'd like to thank you for joining us on The Morning Show. Thank you very much.